Now, you alone can single-handedly ruin your hair transplant results if you don't really take yourself or your treatment plan seriously. Did you hear what I said? Now, your hair transplant surgeon can do everything right. Good consultation, evaluation, good hair transplant procedure, but you not following these 5 things. Now, if you're coming across this video for the first time, my name is Dr. Echefu. I'm a hair transplant surgeon and hair loss coach. I've helped thousands of my clients regain confidence through hair regrowth and hair transplant. Right here, we don't gatekeep. I teach you and I show you all the tips and tricks when it comes to hair transplant, the right question to ask, the right thing for you to know before you make that decision before a hair transplant. I don't think you'll find it anywhere. Now, if this is you, you don't take yourself seriously or anything seriously, and you're about to go for a hair transplant, you better cancel that procedure. You better cancel it unless you follow these 5 things that I'm going to recommend to you right now. Or you're thinking about your options, you don't even know what options you have. I have one recommendation for you. Just one recommendation. Make an appointment with us at Havila Hair Restoration. Somebody from my team will get in touch with you. We offer free virtual appointments 7 days a week. I promise you. Just make that appointment and somebody will reach out to you. Now, I've had a lot of clients that come in for evaluation for hair transplant, and we have to go through an extensive discussion about hair loss, treatment options, and finally, before we make the decision of hair transplant. A lot of people, sometimes they don't take things seriously. How do you know? They only bring the other people's results, or they tell you everything they've read online. But when it's time to actually take action, they start giving you excuses, you see? Well, here are 5 things I want you to take seriously before you make that decision for hair transplant. Number 1 is, I need you to come prepared when it's time for your consultation. Let me tell you, your consultation is the best place to ask all your questions. Everything you've heard, everything you've read online, all your treatment options, always ask the question, will this work for me? Do you think a hair transplant is what I need right now, or do I have any other options? And you need to be also listen with an open mind, because you might not be a candidate for hair transplant right at that time. You might need other treatments. You might need medical treatments before the hair transplant. You might need other non-surgical treatments before the hair transplant. So I need you to also, when coming with your question, come with the right attitude so that you can listen and understand and also ask the right question. So number 1 is for you to really take that consultation seriously. If you've had blood tests or lab tests done in the past, if you've seen a dermatologist in the past, if you've seen any doctor, trichologist, hair specialist in the past, I need you to bring all that information. I need to look at it. I need to review it so that we can formulate a good treatment plan for you. My point number 2 is you need to take your medication seriously and consistently. It's not just taking it seriously, it's also being consistent with taking your medication, because there's a reason those medications were prescribed, either topical medication or oral medication. And you also need to document any side effects you're having on those medications, because every time you have a follow-up appointment, that means anytime you come back for a follow-up after your initial consultation, you need to review those medications, because you might be on other medication that might interact with the new medication or current medication that was prescribed. So you need to take that seriously. Now you've had your consultation. Now you were prescribed medication. Now the third thing that you need to take seriously is your treatment plan. Yes, every time you have a formal consultation, you're going to have a treatment plan. And what is a treatment plan? You have to understand hair transplant is just one procedure and it's done one day. But hair loss is progressive. So you need a strategy, a long-term strategy. What are you going to be doing before your hair transplant? And what are you supposed to be doing after your hair transplant? So that's a strategy, because you need to think about your hair loss. So number 4 is, you need to speak up when something is unclear or you don't understand. Yes, you need to take that part seriously, because I see that most people, sometimes they don't understand something and they'll wait till the next follow-up to talk about it, next follow-up to talk about it. And if you don't document something or you don't write it down, you tend to forget it. Even when you come to the doctor's office, I tend to see a lot of people forget, and they send text messages or emails after and say, I forgot to talk about this. So document, ask the question, and speak up when something is unclear. And my final point, when it comes to hair transplant specifically, You have to read your pre-operative and your post-operative instructions before your hair transplant, because that's where all the questions you will have. Make sure you read all those instructions before and after when it comes to hair transplant, so that you can actually ask all the questions. Because after the hair transplant procedure, sometimes you become more confused and you don't know what to do. So if you've watched this video to this point, I'm sure you've loved this video. And if you're dealing with hair loss or you're thinking about a hair transplant, make an appointment with us. We offer free virtual appointments 7 days a week, and somebody from my team will get in touch with you. So in summary of what I've said, these are 5 things I recommend you do so that you don't ruin your results when it comes to hair restoration. Number 1 is taking your consultation or your evaluation seriously. Come with all your questions, come with all your documentation, what you've done in the past, what you've used in the past. Take it seriously. Number 2 is taking your medication seriously and consistently. You need to. Number 3 is understanding your treatment plan. And if you don't understand it, which comes to number 4, and if you don't understand it, please speak up when something is unclear and document. And finally is make sure you read your pre-op and your post-op instructions before your actual hair transplant procedure. Now, if you've loved this video, I'm sure you're going to love all other of my videos on YouTube. Head over to YouTube. YouTube name is Dr. Echefu, and watch all the videos that I have on there, because I teach you simple tips and tricks when it comes to hair regrowth and hair transplant. We don't get to keep over here. Until next time, bye-bye.